to raise the line.
Okay, thank you. Hello, everybody, and welcome to the Thurston County COVID-19 Town Hall. Appreciate you tuning in or watching us on our recorded session later. We have a great opportunity in the middle of this ongoing pandemic to answer some of the most often asked questions about COVID-19 and the vaccinations. So my name is J.W. Foster. I am fortunate enough to be the mayor of Yelm, and the health department asked if I would help moderate this, and we have with us today Dr. Abdelmalek, who is the county health officer. I'll tell you a little bit more about her in just a moment. For my background, I did a 34-year career as a firefighter paramedic, 25 years right here in Thurston County, having retired in 2013. And I've followed this pandemic with great interest, and I'm looking to make sure that we can do everything we can in Southeast Thurston County to stay healthy. Dr. Abdelmalek joined us in 2020, right at the peak of what's been going on, and we appreciate her coming all the way out here. She has quite a storied history as well. Most recently, she's been working as an emergency room doctor in the Bay Area. She got her training first, and it's lengthy, so forgive the glasses. Started off as an undergraduate degree in history and integrative biology from UC Berkeley. Attended medical school at the Albert Einstein College of Medicine. I believe that's in the Bronx? Yeah. So one side to the other. Completed her emergency medicine residency at Washington University in St. Louis, and then received the Global Emergency Medicine Training Fellowship and Masters of Public Health at Case Western Reserve University. So we're going to start right in with some of the most often asked questions. People had an opportunity to log into the site and suggest questions, and we've taken the ones that seemed the most popular and abridged them down so that we're going to spend about the next 25 minutes answering some of those questions, or at least Dr. Abdelmalek's going to answer them. I'm going to ask them. So Dr. A, what is the current COVID-19 situation here in Thurston County?
Well, so we're still in the middle of the fifth wave of COVID-19 here in Thurston. As of today, our COVID-19 transmission rate is about 495.2 cases per 100,000 over the past 14 days. We're still watching pretty carefully because we've seen a dip like this in the fifth wave for us before. So we're watching closely, especially as the weather turns colder, to make sure that our trends don't uptick. In the past week, 565 people have been diagnosed with COVID-19 here in Thurston County. We've had 14 COVID-19 related deaths reported to us and 8 COVID-19 reported hospitalizations. So we are cautiously optimistic that our overall case rate is downtrending, but it's still a serious problem that we need to be very watchful over.
So as large as those numbers are, they are trending down, and the capacity of the hospitals to treat people is improving as well?
Yes, we have seen an increase in our hospital capacity as our numbers have
Excellent.
trended.
I'm assuming that this has the trending down in the numbers has something to do with the vaccination rate. What are we looking like in Thurston County for vaccination rates?
So about 56.5% of our total population is fully vaccinated, meaning that they've either completed 2 doses of a Pfizer or Moderna vaccine or a single dose of Johnson & Johnson. So those are pretty good numbers. There's an additional 4+% that have been vaccinated that have been vaccinated through JBLM and other sources. So we're doing pretty well, but there's still room to grow and room for more people to get vaccinated to protect our community. What I'm especially proud of is that when you're looking at folks 12 and older, so folks for whom the COVID-19 vaccine has been fully approved, you're looking at about 71.3% having started the vaccination process. So that's pretty good.
That's very good. So I've heard a lot of folks say, well, I believe I had COVID-19 once or twice even, and I feel that I have a natural immunity from that, so why should I get vaccinated?
So the CDC recently released a scientific study that looked at people who had been previously infected with COVID-19 and compared those who then became vaccinated with those that did not get vaccination later on and looked at their rates of getting COVID-19 again. And they found that folks that did not get vaccinated after becoming infected with COVID-19 got reinfected at more than 2 times the rate of those that went on to get vaccine protection. So we do know that the vaccine does work well and does work better than protection from the COVID vaccine. The other thing that we're learning is that people's immune systems are a little different. So some people have conditions where their immune system might not respond very strongly or may have a mild case of infection. And so there's a lot of variability in terms of the immunity that people get from infection at large, whereas it's much more standardized in terms of when someone gets a COVID-19 vaccine.
Yeah, I'm seeing too that some people don't understand, or they wish to understand better, if people are getting vaccinated, but there's all of these breakthrough cases, people are still getting sick, then what is the point of the vaccination? Why is that helpful still?
Yeah, so interestingly, COVID-19 vaccines do protect people from getting sick. So when we're looking at our recent case rate from February through September of this year, the state just released that data, and 81% of the new cases during that time were in unvaccinated individuals. And this was a time when a significant number, so more than 4.3 million Washingtonians are vaccinated at this point, and fewer than 1% of them have had breakthrough infections.
Oh.
The other really important thing about the vaccine is that it prevents severe illness and death. So when we're looking at our hospitalization rates across the same time period, about 83% of the COVID-19 related hospitalizations were in those who were unvaccinated, and 78% of the COVID-related deaths were in those who were unvaccinated.
So can you talk to us a little bit about where this vaccine came from? It seemed like it came awfully fast, and some folks were a little cautious about that.
So the vaccines that we have today are really built on decades of data. And in terms of mRNA technology that's been used for a number of different purposes, including those in terms of cancer treatments being one of them. These vaccines were studied in randomized controlled studies with tens of thousands of people before being FDA approved. So this has actually undergone some of the most rigorous testing and evaluation in history.
So it's a new type of vaccine that's actually been in production and testing for many years. It was just that technology was now applicable to this new virus, where we hadn't really been able to use it that effectively in such a large scale before.
So mRNA technology has been in development for decades.
Yeah.
This is the first time that we're using it for vaccinations. But it's an old known safe technology. The way it works is this. This is actually really exciting because what it's allowed scientists to do is to take the piece of messenger RNA that codes for a viral protein and put it in a little lipid bubble. And so what that does, so you're not getting genetic material from the virus, you're just getting the instructions for a specific viral protein. And so when you get injected with the vaccine, your body will make that protein. It never interacts in any way with your cell's DNA, but enzymes in the outside of the cell will make the protein, and then your body attacks it. The mRNA itself is extremely fragile and is your body rapidly takes care of it.
I'm going to go way off script here for a second, but you made me think of an analogy. It's as though you were giving your body's immune system a recipe on how to build its own cake, if you will, its own defense against this virus. And once the body's read that recipe, that dissolves, goes away, and the immune system is left to fight this new pathogen. Close?
Definitely close.
Okay, that helps me understand it a little better. Folks were afraid of putting something foreign into their body, but really, it's just an instruction book for the immune system.
Right, to briefly create a protein, not a full virus, and then your body does what it does best. It sees something that's foreign and then mounts a really strong and protective response.
So, what if you have a really strong body in the first place? You're healthy, you eat well, you sleep right, you take supplements. Isn't that enough?
So what we've found is that, you can have severe outcomes. We see severe outcomes at all ages. So even in children, so you don't know when you become infected whether you might be one of those folks with a severe outcome. The other key reason why we recommend getting vaccinated is to protect others in our community. Because even though one person might have a strong immune system, they might have a grandparent or a relative, or they might interact with somebody at work, or at a store or in a place of worship who might not have that same ability to fight off the virus. And the last thing you would want to do is make somebody else sick.
Well, exactly. Which is why my wife and I are being so careful, because we don't want to give it to our vulnerable 3- and 1-year-old grandchildren who aren't able to be protected by vaccines. So transmissibility is huge. But as we do get permissions, the data suggests that the vaccines are safe and effective for the younger crowd. I've seen some questions from young women especially who are concerned about their fertility, about their ability to have children going on. Is the vaccine going to affect that at all?
So I'm very confident in saying that we don't have any indication that that's the case. There have been thousands of successful pregnancies and folks that were vaccinated as part of the initial clinical trials for these vaccines. Further, there was a study for folks that needed in vitro fertilization, so IVF, that looked at the pregnancy success rates between people seeking pregnancy who had antibodies to COVID-19 from the vaccine, antibodies to COVID-19 from the virus, and no antibody protection at all. And they didn't see any difference in successful pregnancies in any of those 3 groups. So everything that we know shows that this is safe for folks and doesn't cause fertility issues.
And would be safe for the fetus and the newborn child as well, maybe even protective?
Yes, so what we do know about pregnant women in COVID is that they're at much higher risk for severe illness than other folks with their same age and medical status. So COVID-19 vaccination is definitely recommended for people who are pregnant and people who are breastfeeding.
When is this going to end, Dr. A? The masking, the distancing, it's become a real social burden, and we're all looking forward to getting back. We're unsure how long we can continue to do this. Do you have an idea?
So what we've learned from the past is that pandemics do take a long time to wind down. It's not a simple on-off switch. What we do know is that we're not quite at the end yet. We do need to continue to mask and distance and protect ourselves and our family members. What I anticipate is that as case rates decline and as we get more safety indicators, we'll be able to have a slow and steady return to public life.
Is it possible that the virus, the COVID-19 virus, will just go away? Like, not that they're the same thing at all, because they're 2 different diseases, but the pathogen that caused the 1918 influenza pandemic doesn't really exist anymore. It's certainly not to a degree that bothers humans. Is this something that's possible with COVID-19?
While we always have to remember that we're talking about a novel virus,
Yes.
that only came into existence in 2019, that is possible. However, with the number of folks who have become ill with COVID-19 and the range across countries in which the virus is circulating, it made this virus, it's too early to tell, but this virus may be something that we're managing over time with with vaccines and protective measures. However, I would not rule out it's becoming extinct either.
Okay, well, it's coming on to that time of year where we're starting to worry about influenza and the rhinoviruses that plague us throughout the winter. What's it looking like for this season coming up, and should people consider getting their flu vaccine as well?
Yeah, so it's one of the things that we learned last winter is that all of the things that we do to keep ourselves safe from COVID-19, the masking and the hand washing and the distancing, all of those key mitigation measures are also effective at reducing the risk of influenza transmission and the transmission of other respiratory illnesses. This winter, as cold season returns and we come into close proximity with one another, it's really essential for us to also add flu vaccination to our protection arsenal, just to prevent that transmission piece.
And if you are of a certain age, not saying that I am, but when would you consider recommending the shingles vaccine and the pneumonia vaccines as well?
So at this point, we do recommend them in alignment with the CDC and ACIP guidance. One of the new things that we've learned about the COVID-19 vaccines is that they can be given at the same time as or in close proximity to other vaccinations. So if you're planning on getting a third additional dose due to immune suppression, or if you qualify for a booster dose, definitely get those. And if you've had a recent flu vaccine or shingles vaccine, don't let that stop you, because the information that we have now is that the vaccinations that you're receiving are effective.
Excellent. That pretty much covers all of the questions that were generated by the survey going out to folks, but is there anything else that you'd like to talk to people about today?
Yeah, I would just like, so we're definitely at a transition point in the pandemic, and I know that we're all tired, and we're going into winter, but hope is just on the horizon. So I just want to encourage everyone to get vaccinated when a vaccine is available to you, and follow those guidelines as the CDC and our Western states pact, come up with them for booster doses and third additional doses. Please get those if you're eligible. Stay safe, avoid large gatherings, stay masked, and thank you for all you're doing to keep yourself and your community safe.
Thank you, great advice. And folks, if you want more information, you can go to the Thurston County Health Department website or the Facebook page. You can sign up to get notifications. They're doing a great job of putting the numbers out and giving good advice for folks to stay healthy this season. We appreciate all that they're doing for our communities, and we hope that you all stay healthy and safe in the upcoming season. Thank you so much for tuning in. Thank you to staff for your support and putting this town hall on. Have a good rest of your day.